Brazil has the dubious distinction, Matt, of having the highest daily death toll from coronavirus in the world, mostly in the cities. But there's increasing concern about indigenous people living along the river where I am now, thousands of miles away in remote communities far from modern medicine. Now, nearer into town, they do have modern medicine, and they say that that is essential. Doctors are absolutely clear there's no herbal cure for Covid-19. But the community we met say they use modern medicine, they value modern medicine, but the herbs in the forest that they have also used for hundreds of years, they do help alleviate the symptoms. Just after dawn, and we're traveling along the Rio Negro, leaving the city of Manaus behind, heading into the rainforest to find out how Covid-19 is affecting Brazil's indigenous people. Coming the other way, a floating clinic that stops at communities along the river to provide health care. Nowadays, they're treating increasing numbers of people with coronavirus. But today, they tell us, one of their own medical workers on board is showing symptoms, so they've had to cut short their trip. Further upriver, deeper into the rainforest, Covid-19 isn't the only danger. President Bolsonaro wants to reduce the area reserved for the people we hope to visit, the original inhabitants of the Amazon. As we glide into shore, the settlement seems almost deserted. We didn't know if we'd be allowed to disembark. The Kambeba people who live here haven't accepted visitors since February. As it turned out, Covid-19 had already hit the community back in March, so they had no fear of us infecting them. People were staying at home, isolating not as individuals, but in families.
Então, quando se fala de quarentena, é para você ficar em casa durante esses 40 dias. E não estar saindo pro sol, do sol para dentro da casa, pegando um chuvisco. Então, tudo isso era prejudicial à doença, né? E aí, então, esse foi o melhor, um dos tratamentos que a gente achou para ajudar o paciente.
170 villagers live here. They value their environment, not just for the minerals, hardwoods and fertile land that the Bolsonaro government covets, but also as a home. Family ties are paramount. The village clinic has been well stocked by the regional authorities. It's apparently easier to get an antibody test in the middle of the Amazon than in much of the UK.
Tô curado.
Miscui trained as a nurse in Manaus and is the daughter of Trikuchuri, the village chief, and Itaquara, a traditional healer.
Olha, já estava com mais de 20 dias, é um mês já, né, Tomé? Que eles chegaram e aí a gente foi fazer todo mundo. Alguns já não deu, mas só que um da família positivou, como é uma contaminação muito rápida, né? Que tipo não deixa ninguém. E aí a gente considerou que todos tivessem também, entendeu? E aí iniciaram um tratamento para o pulmão, né? Um antibiótico junto com a medicação caseira, claro, que a gente nunca abandonou.
Travelling by boat further into the rainforest, Miscui cares for a total of 470 people in 7 communities. Only one of her patients died of Covid-19 and 2 had to go to hospital. The record in her own village is even better. The story of this community is remarkable. Nearly everyone here contracted Covid-19 back at the beginning in March, but no one died. And people here say that's because they used not only modern science, but also traditional indigenous medicine. It was that combination, they say, that was the key. I asked Itaquara to show me the leaves used in the infusion she makes to treat Covid-19. Paeomus baldus, or boldo, was the first.
2 folhas de boldo.
The plants all grow within the village and are generally used for medicinal purposes, but this recipe is new.
Pega 3.
The other leaves smell like garlic.
3 folhas de coalho.
She washes the leaves and adds lemon before boiling. The resulting tea is bitter.
Quando está atacado, a gente bebe 3, 4 vezes no dia. Aí vai arriando o catarro que fica aqui na garganta. Vai arriando. O chá e bebe. Aí depois de tomar esse chá ali, aí se embrulha, aí sai, fica suado. Suado, muito suado mesmo. Aí passa a febre, passa a dor no corpo, passa tudo. E o que está com uma tosse meio fraquinha, mais fraco. E está bem forte, também o remédio tem que ser mais forte, que é para matar o vírus que está lá, né, na garganta. E como deu certo, dá certo mesmo.
Gradually, the community is coming out of lockdown. They feel sorry for anyone suffering alone without family in hospital. For them, they say, the psychological pain would have been too great.
Quando começou a falta de ar e aquele aperto no peito, como se fosse entalando a gente todo, e eu ali, dizendo, deitado nessa rede aí mesmo que está aqui. Gostoso estar ali dormindo, eu vou morrer. Sabe? É interessante o que eu digo para vocês. É uma doença que hoje, para nós indígenas, o isolamento social não é legal. Porque quanto mais você se isola, aí a doença vai lhe matar mais ainda, isolado.
Smallpox, spread by European colonialists, nearly wiped out the Kambeba in the 17th and 18th centuries. President Bolsonaro treats indigenous communities with contempt and is dismissive of Covid-19. The people of this village know better.